Hi, my name's Allie Jorgensmeyer. I'm an 8th semester nursing student. Today is August 31st, 2021 at 12:21 p.m. and I'm going to be demonstrating how to change the tracheostomy dressing today. So first I suctioned my patient and then I noticed that the dressing was soiled, so I'm going to go ahead and change the dressing as well. So I'm going to go into my patient's room. Hi, Mrs. Smith. My name's Allie. I'm going to be your nurse today. Can you please tell me your name and date of birth? Perfect. Okay, so we already did your suctioning, but I noticed that your dressing is a little soiled. So we're going to go ahead and change that, okay? Perfect. I'm going to raise her up to a workable height for me. Hand hygiene again. I'm going to put on some clean gloves. And I'm going to hyperoxygenate her because she's going to spend a little time without the oxygen on while I'm cleaning it. So, just to make sure her sats don't drop. I'm going to have you raise your left hand up at any time you're uncomfortable or need that oxygen back on, okay? So with my clean gloves, I'm just going to remove her old dressing. Making sure not to touch around the stoma. I'm going to go ahead and get my sterile field ready. Open my kit. And in real life, all this stuff wouldn't be touching the outside, but my packaging is a little funky today. I'm going to go ahead and get my sterile gloves on. Hand hygiene. I'm going to move that out of the way as well. Okay, I'm going to go ahead and extend my sterile field now. Bring the shiny side down. And I'm going to move everything in the kit. So I'm going to move this a little closer onto my field. Making sure not to touch that outside border. And my extension piece here. So I'm going to go ahead and get these soaking in this container. I'm going to pour my sterile water in this container, and I would pour more, but I don't have that much in here. And in this container, I'm going to close it back up, set it back down, and then I'm going to pour my hydrogen peroxide in one container where my trach is going to go. But for the purposes of the video, I will not be pouring it actually. So then I'm going to go ahead and remove my inner cannula with my non-dominant hand. So I'm going to take that off. Okay, Mrs. Smith, we're going to clean the inside of your trach, okay? So I'm going to take it out, making sure. And while I was doing this, I would make sure I have an obturator and a trach the same size and a half size smaller at the bedside, just in case. So I'm going to let that soak, and then I'm going to pick up my brush here to clean the inside, and then with my non-dominant hand, I'm going to pick it back up, take it over my trash can, out over my sterile field, and clean the inside of the cannula, and drop. Then I'm going to go ahead and set it in just saline here, normal sterile water. And then while that's sitting there, I'm going to let that sit there for a couple minutes. I'm going to go in with my dominant hand and pick it up and tap it on the inside of the container to make sure it's sterile still. I'm gonna replace it, going at an angle and then turn. And make sure it is locked. Perfect. I am going to clean the faceplate and under the faceplate now with these sterile, like Q-tip things. So I'm going to be careful not to touch with my hand. So I'm cleaning the top faceplate now. I'm gonna drop, grab again. I'm gonna go under the faceplate this time. Making sure and get it nice and clean. Perfect. And then I'm gonna grab my trach ties and replace those. And this part isn't sterile anymore because we are not around the stoma. I'm gonna leave my old trach ties on there just to be sure that, ensure that we are keeping that airway there. Get it. And I want to make sure that I can fit one finger in between there, and then I'll go ahead and remove the old trach ties. Make sure to hold. And I can fix this now. Let's be more snug. Okay, so that part's done. So now I'm gonna go ahead and I would change my sterile gloves, but for the purposes of the video, I will not be doing that. But I would change them into new ones. So now I'm gonna put on my new dressing. I'm just gonna make sure not to touch the inner part to ensure that around the stoma doesn't get any sort of infection. So I'm just gonna push the dressing up. Pull it up around, trying to stay out as far outside as I can. Making sure that it gets under that faceplate. And I'm going to replace the oxygen. Make sure that that dressing is straight and there's no like lumps or bumps or anything. Replace the oxygen, lower Mrs. Smith back down, and give her her call light, and then I'll go document the procedure.